When we introduced the topic of motivational interviewing, and so myself as a pharmacist coming in with more limited training than our psychology colleagues, something that I really try to take away from it is it's really patient-led conversation. So we want to listen to our patients, and we want to listen to understand. The second point would be really try to use open-ended questions to draw out more information from our patients. When we're asking yes, no, that's often all we're going to get is a yes or a no. If we answer a question which elicits more of a response from our patient, we're going to get so much more information. And then probably the third point with that is linked to the first point, which is when we listen to understand, we oftentimes can get mixed messages from our patients. So we might hear some change talk, so where patients are bringing up things that would suggest to us that there are reasons for them to want to change their therapy. But then we also might hear some what we call sustained talk, which is the patients wanting to maintain status quo. So as we practice these listening skills and these communication strategies, it's really nuanced listening and trying to draw out motivation from our patients through open-ended questions. Some things that we can hear in practice would be we introduce to the patient the possibility of an opioid reduction based on safety parameters. So a patient, say, has obstructive sleep apnea, it's getting worse, they're unable to wear a CPAP at night due to claustrophobia or a number of reasons. And so the patient comes in and they say, my wife wakes me up every night because she's afraid, or she sees that I kind of stop breathing or I kind of start choking. And yeah, that worries her a lot. It does kind of worry me too. But I've been on this dose for a long time. I trust my doctor. He's not going to do anything that he didn't think was safe. And so I think things are okay where they are right now. And so within that statement, we hear kind of two different examples where the patient recognizes it's causing some change between he and his wife. His wife is concerned about the impact of opioids on his breathing at night, and that also worries him. So we would classify that as change talk because that's something within himself that is causing worry. But then we also hear the patient say he trusts his doctor. He trusts in the process that things are going according to plan based on his relationship with his provider. So that we could classify more as sustained talk because the patient is saying, the status quo is going okay. I have these worries, but things are going okay. So oftentimes in the course of an appointment, we can hear both. Motivational interviewing can feel kind of unnatural at first because, especially in a 15 or 20-minute appointment, we must come in with an agenda of bullet points that we want to discuss with our patient. But oftentimes, if we kind of flip the way that we're answering questions from, things are going okay, aren't they? Yes, no, but to say, tell me how things are going, we can often get much more information out of the patient using an open-ended question. So the first thing is that I recommend to providers is just really trying to ask only open-ended questions to get more information, and then certainly that can help guide the conversation. And really, we can still get to all of those bullet points, all of those things on the checklist, but just asking it in a different way to get more information.